If you're a healthcare pro getting ready for the OET, you already know the listening test is more than just an exam, right? It feels like a real-time clinical simulation where you have to catch that one critical detail in a patient consultation while the clock is just ticking away. So how do you even train for that kind of pressure? Well, don't worry, we're about to break down the entire game plan for you.
So, what really is the secret? I mean, is it just about putting in hours and hours of listening, hoping something sticks? Or is there a smarter, more strategic way to prepare? The answer is absolutely strategy. And today, we're going to lay out the exact, actionable plan that can take you from just passing to totally acing this thing. Let's dive in. Okay, here's our roadmap for this explainer. First, we're going to diagnose the test itself, get to know our opponent. Then, we'll break down the specific strategy for each of the three parts. And finally, we'll put it all together into a practice plan you can actually use. Sound good? Let's get started.
Right. First things first. Before we can come up with a treatment, we have to understand the condition. Think of this as a quick diagnosis of the OET listening test. We need to know its structure, its anatomy, before we can figure out how to beat it.
So the listening test is basically split into three totally different challenges. You've got part A, which is like a sprint. It demands super precise note-taking and a couple of fast-paced consultations. Then there's part B, which is all about quick thinking. You get 6 short workplace clips, like a patient handover, and you have to get the main idea instantly. And finally, part C. That's the marathon. It requires sustained, deep focus to follow a long argument in a presentation. Each part really does test a completely different listening muscle.
All right, let's get into our first treatment plan, how to tackle part A. You know, for a lot of people, this is the most frantic part of the whole test. And it really all comes down to one thing, capturing those critical details with 100% accuracy.
Here's the most important thing to get about part A. Your goal is not to understand the patient's entire life story. No, it's more like a surgical procedure. Your job is to surgically extract specific pieces of information, a dosage, a symptom, a date, and write it down perfectly. That's it. Nothing more, nothing less. So, how do you actually do that? Well, it's a pretty simple 3-step process. First, you've got to use that short pause before the audio starts to scan the gaps in the notes. Predict what you're listening for. Is it a number, a body part, a type of medication? Next, listen for keywords, of course, but also listen for synonyms. The patient might say they feel woozy, but the notes might say dizziness. And third, and this is so important, just write down what you hear. Don't try to interpret it or change it. Your job is to capture, not analyze. This quote really hits the nail on the head. As OET prep experts say, it's not about understanding every single word. It's about that selective listening, that ability to zone in on what's needed and transcribe it accurately. Your one and only mission is to fill those gaps. Okay, let's keep moving. Part B is where we switch gears completely. We're leaving the one-on-one consultation and stepping into the broader healthcare workplace. We're talking team briefings, shift handovers, and quick updates between colleagues. Now, with Part B, the goal totally flips. Forget those tiny little details from Part A. Now, it's all about the bigger picture. In these short audio clips, you need to be asking yourself, what's the main point here? Why is this person saying this right now? It's a huge shift from listening for what is said to really understanding why it's being said. To nail this part, you have to activate a few different listening skills. You need to identify the speaker's purpose. Are they just informing or are they giving an instruction? You also have to pinpoint that single main idea. What's the one thing they really want to get across? Then you got to decode their attitude from their tone of voice. And finally, you have to become an expert at spotting distractors. Those are the tricky multiple choice options that sound right because they use words from the audio, but they're actually wrong. And now, we've arrived at the final section, the part that's all about focus and endurance. Part C. This is where you'll listen to 2 much longer recordings, something like a university lecture or a professional interview. The whole objective in Part C is to follow a complex argument from start to finish. You're not just grabbing random facts anymore, you're actually tracking the speaker's opinion, noticing how it evolves and changes. It's all about staying mentally locked in and picking up on those subtle shifts over a longer stretch of time. Now, one of the big hurdles for people in Part C is the variety of accents you'll hear. You might get a British speaker, then an American one, then an Australian. But listen, they're not doing this to trick you. It's meant to reflect what it's really like to work in healthcare today. It's a global field. The only way to get comfortable with this is to expose yourself to lots of different accents in your practice time. The questions you'll get in Part C basically fall into two camps. You have gist questions, which ask about the speaker's main point or their overall opinion. And then you have detail questions, which force you to pinpoint specific facts or examples they use to back up that main point. You have to be nimble, able to switch from that 30,000-foot view down to the nitty-gritty details and back again.
So we've got the strategies down for each part, but let's be real. A strategy is pretty useless if you don't practice it. This brings us to the most important section of all, your personal practice plan. Think of this as your rehab regimen to build up those listening muscles.
The goal here is to practice smarter, not just harder. I want you to follow this simple 3-step cycle. First, learn the strategy for just one part at a time. Isolate your training. Then, do timed practice. Use official materials to make it feel just like the real exam. And finally, and this is where the magic happens, targeted feedback. Don't just see a wrong answer and move on. You have to ask why you got it wrong. Did you mishear a number? Did you fall for a distractor? That deep analysis is where you'll see real improvement.
So where do you find good practice material? Well, you should always start with the gold standard, the official sample tests on the OET website. After that, places like E2 Language and OET Online have some great mock tests. But here's a pro tip. Don't just do test prep. Immerse yourself. Listen to authentic medical content, like the Health Report podcast or medical TED Talks. It makes practice feel way less like studying and more like just keeping up with your profession. At the end of the day, just remember this. Acing the OET listening test has nothing to do with luck. It all comes down to understanding the test, having the right strategy for each part, and then putting in the work with a consistent, focused practice plan. So there you have it. That's the complete blueprint. You now have the strategy for every single part of the test, and you know how to practice in a way that actually works. The only question left is, which part are you going to start with? Pick one, start today, and turn this challenge into one of your biggest strengths. You've got this.